So now that it is established that you have osteoarthritis, you have a pain in the knee and difficulty in walking or doing your daily activities. So these are the symptoms which you get because of osteoarthritis. So once you have osteoarthritis, we need to manage it. So you need to come to us, who will take an X-ray, simple X-ray. We'll first examine you, listen to your problems, examine you, then take an X-ray. Once the X-ray shows that there is a gap between the two bones is lost or is getting lost, so we stage it accordingly. In stage 1, it is graded up to 4 stages. In grade 1 and 2, where you have a pain occasionally or difficulty in getting out of the chair, then we say that it is a grade 1 osteoarthritis, where we give some medication. There is no certain medication, some medication. The medication is some diet supplements and as well as give you good exercises, physical means, and for heaven's sake, no bracing at this stage. It is the muscles which need to be strengthened. By using the brace, you are weakening your muscles. Lot of people put on a brace in their knees as soon as they have start getting pain, and it is a wrong thing to do because your muscles stop functioning and you start progressing faster to the end stage arthritis. So the management in the initial stage, that is stage 1 and 2, is good exercises. Take precautions which increases load on the knee, like reducing your weight, reducing your activities like sitting cross-legged, squatting or climbing up and down the stairs. These things should be avoided once you start getting knee pain, and do good exercise to strengthen your muscles. Take some medications which we doctors prescribe, which are mostly food supplement. There is no specific medication, but some medication is good. So take this some medication and do good exercises. Keep a regular follow-up with your physician and you should be alright. Those who progress to stage 3, that means you have got a difficulty in walking, you have got difficulty in getting out of the chair and bed, you get difficulty in maintaining your daily activities, or the pain is excessive at night. You are getting out of the bed at night and because of the pain, or going to toilet is very difficult, you need some assistance. At this stage, we will need surgery. That surgery is again different types. It is not that all arthritis patient, as everybody says, do not need a knee replacement. Those we assess the patient, first we take your history, we examine how much is your difficulty and we plan our surgery accordingly. The surgery includes, one is arthroscopic debridement, where we take out all the irregular bones. Second is aligning your bone. As I told you, knee is got a beautiful alignment and balance. So we align your bone by cutting some bones and aligning it to the normal, so that the weight goes through the normal side, and abnormal side which is affected first will be saved. That is in grade 3, or where one part of the joint is only damaged. Suppose there are 3 compartments, as I told you in knee. Suppose one part of the compartment is joint, then we replace that part only. Or we have now what we call a cartilage replacement therapy, where we give your own blood with the stem cells and inject at small areas. If it is a small, less than 1 centimeter, we inject stem cell, which is called plasma replacement therapy or plasma therapy, which is very effective in early stages, where 1 centimeter less or less is cartilage is lost. Or we do cut the bones and align your bone to the normal axis, which is called an osteotomy. We put a camera inside your knee and debride your joint, which we call an arthroscopy. So these are the preliminary surgeries that we do if you are having all the 3 symptoms that I told you. Next stage, when you are having excessive pain and your knees are excessively bent and you have got a gross instability, that means looseness in the joint, then you need to go for a surgery, final surgery called a knee replacement. So knee replacement is the end stage surgery for an end stage arthritis. The patient has got difficulty in walking, getting out of the bed, he is wobbling, he is not able to go even 10 to 20 yards, and every time he keeps asking for help or takes a walker or a stick to walk. In that stage, when the joint space is completely lost, then we say that you need to go for knee replacement.